everyone, we're at the Wyatt conference here and we're with Ken Wyatt, who is the Assistant Minister for Health and Aged Care. And we just wanted to hear a little bit more about that committee that you've just announced.
So the implementation plan has 7 domains, and those 7 domains are around the way in which we target the health needs of our people based on the segments of life. But equally, what's important is the 7th domain, which is around the social determinants that impact on our lives. Because 31% impact by social determinants in health outcomes means we're going to have a challenge closing the gap. So part of our way forward is to have Aboriginal voices around the table when discussions happen, because an agency can do it. But I've always pushed for and been a strong believer that nothing will change until our people sit at the table.
Absolutely.
And this enables that to occur. So when I announced that this morning, it's our commitment to addressing very seriously the issues within the implementation plan, because we want to see, and I'm going to change it from closing the gap in the context of what I want to explain. If we've achieved a 60% level of improvement in any area, we should then say, what's our next step forward?
Yeah.
And how do we build on that?
Fantastic.
So let's celebrate success, but equally, the work that they're going to do for myself and for Minister Lee and Minister Gillespie is absolutely critical to the way we address Aboriginal health.
Fantastic. So another question then for you. So obviously one of the social determinants of health is racism. That's something that's quite hard to tackle. How do you think we're actually going to tackle that to close the gap?
Actually, what I want the committee to do is to look at what already exists in respect to strategies that tackle racism, because every state and territory and a lot of Aboriginal communities have developed approaches to dealing with this. But what I want to do is look at how we affect government agencies, because they're critical in this process. It's also frontline services that have attitudes, or where we have work that is effective and where there is an incredible partnership between our people and mainstream Australia, then let's celebrate those and use those as examples as to why they work, and then what can we do to make that work in other areas.
Fantastic. It's great to see that closing the gap is moving beyond just chronic disease to actually looking at social determinants, so I'm quite excited by that. In terms of racism though, one of the things that's happening at the moment is the conversation has risen again around 18C. I mean, that potentially is going to have a significant impact on our mob. How do you respond to that?
Look, I think Section 18C is important, but in a couple of other interviews I've done, I've indicated that we probably need to now look at the wording of Section 18C. What we've seen is a number of cases have been taken to the courts. My understanding is only 5 of all of the cases ever taken under Section 18C have been successful. But I think I'm more interested in looking at a set of words that protect us in the future.
Okay.
Because 41 years ago, the wording was absolutely critical, and I welcomed the Act when it was implemented. But I think given that we've moved on 41 years from then I think there is a need to revisit. What I don't want to do is see the debate extend in a way that is destructive. And I will always make sure that I fight for the protection of people so that they are not racially vilified.
So it does have the potential to actually go down the path of having a hierarchy of human rights where freedom of speech trumps our right to be free from racism.
But you can also have freedom of speech in which you are respectful. And freedom of speech is not just about this issue either. It's about the rights of Aboriginal and Torres Strait Islander people also to equally speak up about issues that are confronting them, that are challenging in the reforms and changes they want. So there's many facets to this that we've seriously got to consider, but I don't want to see a narrow scope of argument that says freedom of speech is being impeded by an act of Parliament. Because there are a number of pieces of legislation that do have inhibitors on releasing information publicly. And you could draw a bow on that and say that's limiting freedom of speech. But in that context, that limitation is to protect either the integrity of data or integrity of people implementing programs, or the integrity of protecting Australian society. So there are many layers in that protection. But we've got to have freedom of speech in one sense, to be able to talk about issues that are absolutely critical. And 18D gives us that.
It does. It has a huge amount of protections in it.
It does. But what I don't want to see either is a parliament that is persuaded in the way in which it may repeal Section 18C. I would rather see a reconstruction that has strong words that still protects against vilification and racism.
Fantastic, excellent. We know that you've got short-term time. Is there anything else you'd like to add?
No, it's great to see Croakey here, and I would love to spend the next 3 days here, because I've looked at the agenda and there's some incredible themes emerging, but some incredible papers that people are going to present.
There is.
So I look forward to what you report on, and my sadness is I've got to return to Parliament.
Canberra's not the... Yes.
I know Canberra I love the work I do in Canberra, because you participate in a democracy.
I do like that about Canberra, and I do think Parliament House is beautiful. And I'm going to do a little plug here for a moment. We're going to send you the Just Justice ebook, which has just gone to the printer, which I don't know if you've heard about, but it's a series we've been writing for Croakey about the over-incarceration of Aboriginal and Torres Strait Islander peoples, and it's links to health. So we'll send you a copy of that.
I'll welcome that, because I've also, from an aged care perspective, I've been looking at senior Australians who are incarcerated that may be showing signs of dementia, Alzheimer's, and problems that you normally see with ageing Australians. So I do have a very strong interest in people incarcerated within prisons, because it does impact on their health in terms of what I'm responsible for.
Excellent.
Minister, could we ask you just one quick question, because I know we're in budget preparation mode. Concerns about short-term funding over the past through the Indigenous Advancement Strategy. Are you concerned about how it's facing for health?
Let me say, in terms of the budget, I focus on the health portfolio. So those are the debates I'm having at the moment. In terms of Minister Scullion's programs, then I would assume that he also would be putting forward some of the strategies that he has in mind as the Minister responsible for Aboriginal Affairs, and on that basis he would have the detail of his budget. It's not my practice to comment on other ministers' budgets. I want to focus on our budget for aged care and for Aboriginal health, because those are the two critical areas, plus the budgets that I have responsibility for: the Organ and Tissue Transplant Authority, the National Blood Authority, Dementia, and Australian Hearing Services.
Just one thing though, it's social emotional wellbeing though, and drug and alcohol fall under the IAS, and they're actually health related. I think that's one of the tensions with the IAS.
Look, there were programs that were determined to be part of the IAS, and it was agreed by the agencies that they would transfer, so they were transferred into the Prime Minister and Cabinet. But look, I'm focusing on the health budgets and the aged care budget, so that's my priority at the moment. That's the patch I want to protect.
Thank you very much,
Minister.